All that you need to do is decrease the inflammation within the joint by resting the joint using a very simple device that unloads the joint. That's all you do with this thing. You unload the temporomandibular joint according to a protocol. You just don't unload it for 10 minutes. You have to use a proper protocol and decrease the inflammation. So the prevalence with just the misdiagnosis, misdirection of the physicians diagnosing migraine headaches and adds at least 10% of the prevalence to this problem. And then when you include earaches, which is another extremely common symptom that patients present to their PCP, and if the PCP doesn't handle it or want to handle it, he will send it to the ENT, ear, nose, and throat, otolaryngologist, of which somebody's going to look in the ear with an otoscope, speculum and little light otoscope, and see if they can find inflammation or infection within the ear. Almost exclusively, if you go to a convenient care clinic or walk-in clinic, the nurse practitioner, physician's assistant will, whether she can see or he can see infection, they're not really good at looking through that otoscope, I can promise you that. 100% of the time, if you walk into a convenient care clinic with the symptom of earache, you will walk out with a prescription for antibiotics, 100% of the time. Their thought process is well outside thinking about TMD is causing what feels to the patient like an earache, and it does. And I've explained how that anatomically can occur.